Okay, I just want to say thank you everyone for being here. We'll get started in about 1 minute, just giving people time to log on. Okay, we're going to go ahead and get started here. So good afternoon. I'm Jonathan Lynch with CDC's Environmental Health Nexus. Thank you for joining us for today's Hurricane Safety and Preparedness webinar. Today, we're going to hear from Douglas Hilderbrand and Vivi Siegel. Douglas Hilderbrand is a meteorologist at the National Weather Service's headquarters. He is the Preparedness and Resilience Program Lead. That includes the Weather Ready Nation Ambassador, Storm Ready, and Skywarn programs. Doug collaborates with National Weather Service forecast offices, others in NOAA, the Weather, Water, and Climate Enterprise, and over 12,000 ambassador organizations. Vivi Siegel is the Crisis and Emergency Risk Communication Lead for CDC's National Center for Environmental Health and Agency for Toxic Substances and Disease Registry. She helps lead CDC communications during responses for natural, chemical, and radiological disasters. If you do not wish for your participation to be recorded, please exit at this time. Today's webinar is interactive. To make a comment, click the chat button on your screen and enter your thoughts. Closed captions are available for this webinar. Thank you. Doug, I'm tossing it to you.
Thank you so much, Jonathan, and thank you everybody for participating. In a real passion of mine, I absolutely love hurricanes. I studied them in graduate school, and I always look forward to this time of year because this is the time where, you know, a little bit of prevention can go a long way as we ramp up into hurricane season in just about a week, and then really getting active, you know, in the peak months of August, September into October. So I'm going to share my screen. All right, Jonathan, I think you need to undo. There we go. Perfect. How is this? Are we good?
Looks good.
Okay, excellent. So I think a number one headline, especially over the last 4 or 5 years, is that hurricane season has been extremely busy in the Atlantic. You can look at all the paths of our only landfalling hurricanes. This is not all hurricanes that have formed, but only landfalling hurricanes. Absolutely tremendous number of hurricanes making landfall with over $300 billion in damage, 18 of which caused more than $1 billion in damage. And you can even see down there with Hurricane Ida last year, $75 billion. Tremendous amount. And, you know, what we're looking at, you know, coming up this year is sort of a more of the same. This literally came out under 2 hours ago, but NOAA released its 2022 Atlantic Hurricane Season Outlook. And this outlook is probabilistic in nature, as you can see the pie chart there, where, you know, looking at the next, you know, 5 to 6 months, we're looking at above, you know, a greater percentage of above normal probability here. So 65% above average. There is still a chance because, long-term conditions can change. We're still in a La Nina. This is our third year now of La Nina, and a La Nina year really lends itself to above average activity here. So normal named storms would be about 14, 7 hurricanes, and 3 major hurricanes. So you see the prediction there of the number of storms, hurricanes, and major hurricanes is average at the low end and well above average there on the high end. But with all of that being said, expecting an above average season, it only takes one to strike your community for it to be an above average season. And that's very important, regardless of how active the entire season is. We just a couple of weeks ago finished up the 2022 National Hurricane Preparedness Week. You can see the website at the bottom there. And really what we're trying to do ahead of hurricane season is get communities prepared. We had themes for each day. This was one of our themes of just even determining your risk, looking at the various hazards that come with a hurricane, and get your house, get your finances, get your emergency kits kind of all in good order, but then also taking the time to reach out to those most vulnerable and making sure that they are prepared as well. So I'm going to switch gears a little bit and really kind of focus on 10 what we call gotchas, but they're really, they could be misnomers or myths or things really to think about hurricanes in a different way than you're typically used to seeing. So just jumping right into it, hurricanes don't care about your timelines. What do we mean by that? Hurricanes can go from a tropical storm, even a disorganized tropical system, into a major hurricane in really no time at all, less than 3 days there. And so these are all examples of Category 5 hurricanes that have made landfall in the United States. They were tropical storms 3 days out. So this idea that, we track these hurricanes off the coast of Africa, and we have 7, maybe even 10 days to kind of keep an eye on it to prepare, that's a misnomer. You actually can get hurricanes and other tropical systems spinning up even near the coastline where there isn't a whole lot of time to take that immediate action. Number 2 is that little wiggles matter. And what do we mean by that is that, oftentimes you'll see a slight shift in that hurricane as it approaches land. And there are various reasons why that is. Hurricanes are very dynamic systems. If they, interact with its environment in subtle ways, it can just shift that track a little bit. And so this is just an image showing how different the storm surge could be if landfall had made 20 miles to the left there, to the farther west. And so you can see that, if you're emergency management, if you're a community, if you're a hospital along the coast, you've got to be thinking of the worst case scenario, that what if there was that shift in track? You don't want to be unprepared. Next couple of slides talk about how every storm is different. There are storms that are very well forecast and are sort of easy to forecast. They kind of behave, as we like to say in meteorology. And then there are others that don't behave, and they are very challenging. But one of the rules of thumb is that as the storm's intensity increases, our National Hurricane Center average track error gets smaller. And so, we use various computer models. We call them an ensemble of models, where we take a look at how the atmosphere behaves based on different conditions and different physics packages. And that's really what we're trying to do, is determine what the predictability is with these storms. That some storms you can impact it physically a little bit and you'll get a very wide spread in outcomes. And then in other storms, even significant impacts or, physics changes, doesn't really change its path all that much. And so every storm is different. Number 4 here is is an interesting one, and it's one that we really need to be paying more attention to, and that's indirect fatalities. The headlines are all about maximum winds, maximum storm surge, sort of those direct fatalities of trees falling on homes and objects becoming airborne. But we also really need to be paying attention and prepared for indirect threats. What would that be? If it were a winter storm, it's shoveling that snow can put vascular impacts on you. Same thing with a hurricane. It puts stress on the body. It puts stress in trying to clean up. We have impacts on even evacuations and vehicle incidents. There could be debris in the road. There could just simply be traffic if everyone decides to evacuate, sort of at the same time. Power outages always come with issues, from carbon monoxide to chainsaws to, the smell of gas, that type of thing. And then you see there that, your age does matter in all of this. And you can see statistics there of various age groups. Taking Ida as an example and comparing direct and indirect fatalities, it actually didn't have that many deaths as it made landfall in Louisiana, only 4, and then 2 in Mississippi. But then 1,000 miles away in the Mid-Atlantic and in New Jersey, New York, 49 direct fatalities. So you can't correlate direct fatalities with just the coast in which the storm makes landfall. But you can see there the flooding, sort of the typical hazards of a hurricane, wind, storm surge, tornado. But then let's look at the indirect fatalities. So here's Louisiana. It gets a direct landfalling hurricane with 4 fatalities, but 26 indirect fatalities, 13 of which were heat related. That's often common when you have power outages and people trying to clean up and overexert themselves. 6 of them, unfortunately, are carbon monoxide. So when you have the power outages, you have the generators, and people need to be prepared and knowledgeable of how to operate those power generators. But then there were only 4 indirect in the Mid-Atlantic states. So you can see the juxtaposition of indirect fatalities. A term we use in meteorology and other sciences is, looking at potential outcomes or solutions of a forecast deterministically. And all that is taking, say, one computer model, and maybe it's an outlier, but then kind of going, talking up a little bit too much hype, or focusing more on one solution versus the array of solutions that you can have in an ensemble. And so you can see here, this graph shows over the decades how much better we are with the track error. And 2020 and 2021 was, absolutely record performance from the National Hurricane Center. And to kind of continue the probabilistic forecast, most of our products are probabilistic. Meteorology, by its nature, is a probabilistic science. And again, not focusing on a deterministic or sort of one solution outcome. And what we've learned with Ida here is this excessive rainfall outlook. If I were to post, the tornado outlook, people grab hold of that headline. Oh, there's going to be a threat for tornadoes. And what we saw with Ida is people took notice and were preparing for the severe weather from Ida, from the remnants of Ida, but overlooked time and again the excessive rainfall danger. And so it's actually not the National Hurricane Center that issues these excessive rainfall. It's our Weather Prediction Center. And, you can see how when they issue a high risk day, it is a big deal and it's quite rare. So number 6, again, going back to forecast accuracy, we are, investing time and energy on always being better at the forecast. Forecast accuracy results in better decisions. It's a very much a physical science issue. And we'll get back to the sort of human behavior and social science side of the equation in a little bit. But you can see, again, using your ensembles, you can see the spread. And it's those, well-experienced forecasters that can make sense of all of this and really nail down an accurate track there. And we call these spaghetti models, where the National Hurricane Center is looking at more than 50 and not just one run. And so why does forecast accuracy matter? Here's a great example between, basically 20 years apart. Hurricane Floyd, which I remember well because I was in Raleigh, North Carolina at NC State for grad school and felt the impacts of Hurricane Floyd. But you see there, 2.6 million people, especially in Florida, were evacuated because it really got close to the East Coast there of Florida and the Georgia and the Carolinas, where with the monster, major Hurricane Dorian 20 years later, as many as 3 million people, mostly again in Florida, were not evacuated. So you can imagine the cost savings of dollars and of needless time and energy to avoid those evacuations with an accurate forecast, and not only an accurate forecast, but a confident forecast, so that emergency managers and those decision makers are going to act on that information. So transitioning a little bit, from sort of the physical science aspect of hurricanes to now the social science part of the equation here, and that's words matter. Over the last 5 years, we've improved the way we communicate and measure storm surge, and we use the term feet above ground. And previously, you would have a 10-foot storm surge, but then you would have to add the tides, you'd have to add the height above sea level that location is. There was a lot of other information that you had to take into account. Now it's all done for you in these maps that really determine what's the storm surge going to be like in my location compared to my home. And that, has been an incredible success. In 2017, we started with these storm surge warnings that had never been issued that now are issued. We have inundation maps where it can show down to the street level the potential depth of the water in your location, and that drives people to action. But even with all of that, we have people who will resist, and we use words like unsurvivable. Hurricane Michael, Category 5 hurricane, we would be using words like this, that if you're in that, peak storm surge area, you very well may be looking at something that is not survivable. And, there are 6 tropical storms and hurricanes profiled here in this slide. But since 2017, with several major hurricanes making landfall in the United States, the latest total of storm surge deaths is 8. And that is a testament to much of the improvements in not only storm surge forecasting, but storm surge communications. So I love the title of this slide. There's no such thing as storm justa. And what do we mean by that is whether it's a monster Category 5 hurricane or even a tropical storm, you can still have a tremendous amount of damage caused by the storm itself. And you can be, we never want to hear anyone say, well, it's just a Category 1 hurricane, as if that's something to dismiss, ignore, not take the preparedness actions that you would normally take, even, you know, if it's a category 2, 3, 4, or 5. And with all of that, we really are trying to communicate the impacts. Impacts can skyrocket as the storm makes landfall. Impacts can increase even as the storm itself is, you know, losing its strength by making landfall, not being able to tap the warm waters. You know, and the impacts can really be, you know, far removed from the, you know, center of circulation or even the storm itself. We see impacts for storm surge, onshore flow. We saw this with Irma as it was making landfall in the Keys and sort of southwest Florida, as far up north as Jacksonville got tremendous amount of flooding damage from Irma, even though, you know, it wasn't anywhere near the center of the action. And so we try to communicate this with our text products, and, you know, this gets tweeted and posted 6 or 4 times a day, every 6 hours. And again, the focus is less on the meteorology, more on the impacts. And our 10th and final sort of gotcha is there's no such thing as a fish storm. And that's a term people actually use. Oh, it's just a fish storm. The reality is there is no such thing as a fish storm, because hurricanes can impact shipping lanes. It can impact rip current, you know, coastal conditions with rip currents. And here's an example of Hurricane Lorenzo, thousands of miles from the US, yet, you know, 8 people died because of the rip currents that it generated, and the tragedy, you know, at sea. And so that is why when you see a forecast for a storm out in the middle Atlantic and you're thinking, why even bother? Certainly there are reasons. So my last slide, it's kind of busy there, and it, you know, references four projects that I don't have time to get into. But what I hope you can pick out of each of these graphics is that we're really looking at the full beginning to end decision-making process. We're looking for accessibility. We're looking for different types of information, the timing of that information, how to communicate the uncertainty of that information. Graphical products, you know, are people misinterpreting the product or the language that we're using? That's really where I think the biggest leap in improvements are to come. We can only physically be so accurate, but we do have a lot to learn and a lot of progress to make in the human dimension. So with that, I would like to, let's see, unshare my screen. I think we're good. And I'd like to pass it on to Vivi Siegel. Vivi, take it away.
That was great. That was really interesting. I am thinking about how CDC can better also support you in messaging around storm surge warnings. Anyway, I know we don't know what this summer is going to look like yet, or this hurricane season, but I can say that I am very happy to be working with you and to have the partnership between our agencies going into this. So hi, everybody. My name is Vivi Siegel. As Jonathan mentioned, my focus is crisis and emergency risk communications, including for natural disasters. Next slide, please.
Vivi, real quick, don't forget to turn on your camera.
No, you want to see me. All right, I can do that.
And we have a poll.
Okay. Hi, everybody. So before we get started into the slides, we did want to ask everyone a little bit more about where you are joining us from, and what kind of organization you're representing as we're going into hurricane season this year. So if you don't mind filling out a little poll. And if you need to elaborate on any of these responses, please do so in the chat. Hi, Rebecca from Arkansas, Molly from Maryland, and Bob from CDC. I'm seeing that we have a lot of our regular partners in a natural disaster on the line, so that is great. Renee, is everyone done voting? And are we able to display the results? Okay, fantastic. So we have a really good mix of folks from different parts of government, and some of you are not representing government. And I think this is really important. Question coming up in a few minutes. I wanted to really briefly talk about, if we can go to the next slide, just a little bit of the basis of CDC's communications. So CDC uses a crisis and emergency risk communication curriculum that informs all of our emergency communications. And these are just a few of the principles up on the screen. Doug talked a bit about communicating uncertainty and how important that is, especially during an emergency where you don't have all of the information right at the beginning, and you're not able to give everyone the answers that they want. We believe you should still try to be there in front of them, talking with them. Be first. Our first CIRC principle means that we want to position ourselves as a trusted source, trusted authority from the beginning of an event, so that people know where to go back to for information when they need it. Knowing that people tend to favor things that they hear earlier over things that they hear later. They stick in your mind more. And also just knowing who your audiences are, and coming from a point of empathy. Could I have the next slide, please? So last year, for any of you who were on this call last year, we had a similar presentation on Nexus, and I'm so happy to be back with this group and their wonderful webinar series. We talked a bit about amending hurricane messages for COVID-19. And so I just want to revisit that for a little bit and talk about how, as the pandemic is evolving and the way that people are reacting to COVID, mitigating COVID, thinking about COVID is changing. We're also changing the way that we're messaging about concurrent disasters, hurricanes that are happening during the pandemic. So really quickly, I'm curious, for those of you who are doing hurricane planning, how much you're incorporating kind of COVID information, messaging, or precautions into that planning. And please feel free to elaborate in the chat as well. And as Jonathan said, I'd be really interested to hear, how things went for you in the last couple of years with regards to COVID and hurricanes, and how that might be changing this year. Okay, poll is closing, I think. Renee, can we see the results? So it sounds like almost everybody had some who was able to vote had some kind of effect from COVID. Some of you have adapted COVID planning from the beginning of the pandemic, and you are continuing to take the same enhanced precautions. Some are, it's as pandemic mitigations are loosening up a little bit. That may be changing a little bit on your hurricane messaging, and then some are continuing on as you did before the pandemic. Thank you for answering. I find that really interesting as we're trying to figure out how to support those of you at the state and local level, going into this hurricane season. And one of the things that we're still very cognizant of is that people are still suffering mental health effects from COVID. Obviously people are continuing to get sick physically from COVID, but they're also still dealing with the weight of this pandemic that has been dragging on for so long. And so for yet another hurricane season, we're having hurricanes on top of this other disaster, and we would consider that a concurrent disaster to have a pandemic and a hurricane happening at the same time. Even if people, have, emotionally moved past COVID, they've moved on, they're still dealing with some of the after effects of the pandemic. And so we want to make sure that we have resources for the community. So this would be materials to help people with stress and coping, and help parents with supporting children, and then also thinking about the responders and those who are the first responders on the ground, but also those responders at different levels who are also dealing with, working 2 years on the pandemic, and the healthcare workers who are now dealing with additional disasters on top of it. I do think that CDC has added some really interesting mental health resources in the last couple of years to our repertoire, just because of the pandemic and the types of feelings that it's brought out. And so I'd encourage you to go visit some of these websites and see what we have, and see if you can find anything that might be useful for this hurricane season. Next slide, please. So what are we messaging this year? So things this year are a little different, as you probably are aware. So CDC rolled out our COVID-19 community level system and guide, and it helps people know what actions they can be taking to stay safe from COVID. And so while planning for hurricane season and while messaging for hurricane season, we are encouraging people to pay attention to what their COVID-19 community level is. And that also means if they think that they might need to evacuate, to also kind of be aware of what's going on with COVID and a place that they might be driving to, evacuating to, and to think about how they can protect themselves while they are getting their home and their family ready for the hurricane. And also to think about how the last couple of years has changed shelters in a lot of places. The shelters are not where they were a few years ago, and so people may need to go back and look and make sure they know where their shelter is and what the plans are. And we're still asking people to think about if they're going to evacuate to a public shelter, or even evacuate to a friend or family's house, to include items like soap, hand sanitizer, and masks, things that can help protect everyone from infectious disease while you're needing to shelter in close proximity to a lot of people. The next slide, please. So here is the COVID-19 community level, the basic chart that we have with some of the basic preventive actions that people can take at the different community levels. And we do have a much more detailed chart on the website that talks about the different additional actions that people can take, such as improving ventilation, thinking about ventilation at low, medium, and high levels, to make sure that levels can stay low if they are low. Next slide, please. I want to talk a little bit more about shelters this year. CDC is still talking about this, so we don't have a finalized guidance yet, but I can talk a little bit about the conversations that we're having. So we know that a emergency shelter is not necessarily going to be the same risk level as when people are living in their homes in the community. So while community levels are important to look at, and we want shelters to look at community levels when they're considering what mitigations to use, what prevention measures to take while they're sheltering people, we also want them to think about the specifics of the building where they are. Are they able to shelter people in non-congregate settings, or do they need to move back to congregate settings, because that could affect what kind of COVID precautions they want to take? Who are the people who are sheltering? Do you have a large group of older people or people with special medical needs or vulnerabilities that might make you want to take some increased precautions? So really thinking about, what is your risk at the community level, and then what is your risk at the specific facility level when deciding what to do, and knowing that different shelters may have different policies this year. And so CDC wants to be able to provide that information so that shelters can use it to scale up if they need it, and to scale down if they don't need it. And just a note that we still support, and I know Red Cross does too, that shelters need to be available for all people, regardless of if they are sick, regardless of if they're vaccinated. But we do want people to, if they're arriving at a shelter and they are feeling sick, to let shelter operators know so that they can separate people who are sick from the rest of the population. Next slide, please. Okay, so I'm going to talk a little bit about some of the educational materials CDC has on hurricanes. And so really quickly, last poll, what are some of the health concerns that you're worried about this hurricane season? And there may be many more than this, and I welcome you to include those in the chat. I think, what Doug was saying about indirect deaths is really important, and we are getting better. We are still, not perfect at being able to count all of the indirect deaths, but we are getting better at being able to count and to know more about what's going on. Thanks to improved disaster epidemiology and really a lot of collaboration between CDC and the states and coroners thinking about how they're filling out death certificates. So one of the things that we think about when we're thinking about indirect deaths are how is this event affecting people with chronic illness? Did the power outage mean that some people weren't able to access their devices that they need to do, or people having harder to access medication, or people having a harder time accessing medical care in general. So I am looking to see flooding. Always a huge concern, and that seems like that's the biggest one, and that continues to be the cause of the most direct deaths during a hurricane. Injuries, carbon monoxide poisoning, mental health, and safe sheltering in the pandemic. It's really helpful. So I do want to just a word because we did get some questions last year when we said, get vaccinated before hurricane season. It's a way you could prepare for hurricane season. And some people said, well, what do you mean? What does getting vaccinated have to do with hurricane season? Getting vaccinated for COVID, CDC is just trying to use any excuse to tell us to get vaccinated for COVID. But I wanted to, and those of you on the phone probably already know this and understand this, but we're trying to make it more clear this year that a big part of this is the pressure that our health systems are under. So when we're thinking about community levels, especially in a community level that is high, when the hospitals, local hospitals, are already seeing fuller wards and fewer beds available to add a natural disaster on top of that when then they are dealing with potentially a power outage, being on generator power, flooding, having to evacuate people who are hooked up to life-saving machines. We don't want to add a lot of new COVID patients on top of that. So anything we can do to think about that while we are experiencing these concurrent disasters is helpful. Next slide, please. So we have some information available on the CDC website about hurricanes and about COVID that is available to download and to use. Almost all of the information is available in English and Spanish, and we are able to translate into additional languages, especially when there's an immediate need. So please don't hesitate to reach out if you know of a need in your community where for materials in a certain language that you don't see on the website that we may be able to help with. Next slide, please. And here are just a few of the COVID materials that are available to hang in shelters or to use, as well as information in American Sign Language. Next slide, please. So here's some of the social media that we and our partners have done, including NOAA and FEMA, during hurricane and the pandemic, just showing how folks are combining messages during these concurrent disasters to help acknowledge that people are going through more than they should be going through, and to try to help them through that. Next slide, please. So let's talk a little bit about coordinating messaging. And I want to make sure I mention that we also have a pretty robust messaging document that some of you may be familiar with for messaging on hurricanes, flooding, and other natural disasters. And all of those messages are in the public domain to be taken, used, put in social media, put in press releases, put on posters or whatever they are needed for, and on a variety of different topics, including, anything from animals, dealing with wild animals after a hurricane, to mold, to mental health, and coping, and some COVID messaging in there too. So that is also available. And I just wanted to just put in another plug for coordinating messaging. Next slide, please. CDC, oh, there it is. The messaging document that I was talking about on the right-hand side. We still use a phase-based approach to messaging during a hurricane, knowing that the phases may not last the same amount of time for every hurricane. You might have a very short phase 1, a long phase 2. It might take a while, depending on how much water damage you're seeing and what the temperature is, it may take longer or shorter time to see some of the longer term flooding and mold issues. But generally, hurricanes follow a pattern, and we can anticipate some of the health needs and messaging needs at each stage of the hurricane. And so we use this kind of as a guide, both to help us know how to reach out to the public and to help us coordinate with our partners at all different levels of government and our non-governmental partners as well, so that we can all be on the same page, knowing that when people are hearing the same messages from multiple places, they're more likely to listen, they're more likely to take notice. I think, I can say, I think we've done a really good job kind of as a federal family of echoing the NOAA message, turn around, don't drown, for avoiding driving into floodwaters. And I see that all over the place during hurricane season, and it's really great to see. So as much as we can be on the same page when we're talking to folks about how they can protect their health, it is helpful. Next slide, please. So just some of our tips for talking about messaging before things happen. So we welcome feedback and input to our messaging document that I showed you and to all of our other communications information. If you have, updated information you want to share, if you want to tell us, this does not work for our community, what we really need is XYZ, I want to hear it. That is helpful to us to be able to improve. And also so that we can iron out any disagreements if there is a disagreement on how to handle any certain topic. So next slide, please. So on that note, I will end my talk and just say that CDC is staged and leaning forward to be able to support any hurricane responses this hurricane season. And I think, Jonathan, I will turn it back to you. I think that you might have some questions, and this might be an opportunity for people to put questions in the chat as well.
Thank you, Vivi. I'm going to start out with asking a few questions of Vivi, then we'll transition to a bit of conversation with Vivi and Doug. Vivi, your first question. How has the changing pandemic situation influenced CDC's natural disaster preparedness plans and recommendations?
How has it not? It's influenced everything that we do, as even down to the fact that a lot of the same people who work on COVID are working on hurricanes and natural disasters too. And I think the last few years have just really emphasized how connected we are, how connected public health is, and how everything affects everything else. And so I know that's kind of a really broad way to answer that, but I will just say that we are trying to stay on top of COVID guidance as it changes so that we can incorporate it also into our natural disaster messaging in ways that would be helpful.
Okay. Next question. What are CDC's priorities for messaging about health and safety this particular season? Yeah,
great question. I think safety, when we think about safety during hurricane season, it's always really hard to see those preventable deaths from carbon monoxide poisoning. There is a lot that we cannot control about a hurricane. As Doug said, we can prepare, we can evacuate, we can avoid certain areas, but there's only so much that you can do in the face of a very strong natural disaster, but carbon monoxide poisoning is always preventable. And so that will continue to be a priority as long as we're seeing even one death, is to get the word out to people about generator safety and power outage safety. We're continuing to think about reminding people of the dangers of floodwaters, and particularly when it comes to driving, because driving through floodwaters is a major cause of accidents and drownings during a natural disaster. And then I think we're really going to be focusing on mental health, getting people through, this season of multiple disasters and dealing with so much, and also thinking about how hurricanes are impacting people with chronic disease, including people who are dealing with longer term effects of COVID.
Okay, so Vivi, just a quick follow-up to that question. We're going to put this recording on the CPR Facebook page, and a large number of people who work in the hurricane response community will see this. Would you encourage them to engage in messaging about safe generator use? You mentioned
Absolutely.
Okay.
Yeah, absolutely. I think just the more we can get that message out, the more people are sick of it because they just see it everywhere, but everyone knows, everyone's thinking about it, everyone's reminded about it, because sometimes people know they're not supposed to run their generator inside, but they think, well, or close to their house, but they don't have a lot of options. There's not a lot of space between houses. They're worried about someone stealing the generator, and there are a lot of reasons why our guidance can be sometimes hard to follow, whether it's for hurricanes or COVID or anything else. So I think we just need to keep reminding people that carbon monoxide can be deadly. It is silent, and we always need to be vigilant.
Thank you. Third question. How can local organizations take advantage of CDC communication tools this season?
Please reach out. Check our website first. If you don't see what you need, please reach out. And I think, Jonathan, you have a way for folks to reach out to Environmental Health Nexus. Is that right?
Yes, absolutely. If you have any follow-up questions, looking for resources, whatever you need, please reach out to ehnexus@cdc.gov.
Thank you. And then, of course, it takes a little bit of, not even that much time extra, but when you reach out to CDC info, that's always directed to the right place, so that when you put your specific questions in there, it usually gets to whoever is the best person to answer that question in CDC, within a few hours. So, which is not to say it's always answered within a few hours, because sometimes there is a backlog, especially during the pandemic, but that is another way to make sure that you're getting connected with the right part of CDC when you're reaching out. And like I said, we do take requests for different types of materials, different languages, based on the needs of your communities. So let us know.
Thank you. And I'm going to transition to you now for your conversation with Doug.
Okay, Doug. Wow. So this presentation really brought up a lot of questions, and I have a few more, but I guess first I want to ask, how can CDC support the National Weather Service and NOAA this hurricane season? And particularly, like, when it comes to health messaging, I know that, in many ways, a National Weather Service is a public health organization as well. And so, are there some ways that we can support you?
Sure. Number one that immediately comes to mind is when we are messaging that we are coordinated, that there is a consistency, that we aren't talking past each other and confusing the public on what to do. I think your details when it comes to the carbon monoxide issue and generators, it's like, yeah, in the real world, you don't want your generator 25 feet from your house. Someone could walk off with it. So that's our challenge as agencies, is really to apply all of this information to the real world, and even going as far as saying, you may have worries about having your generator disappear, but it's not worth going against the operations manual and risking your life and the life of your family. But I think having, you highlighted empathy early on. These are the kinds of things we don't want to sound like mother knows best, or we have all the answers and that you just need to listen to us. We got to keep driving that conversation with communities and with people. Have the empathy. One of the things in talking about mental health, you saw one of the first slides I had, where it was the storm tracks of landfalling hurricanes over the last few years. Those areas are now susceptible to multiple hurricanes in multiple years, where they're getting hit a second, even third time. We had communities in and around Lake Charles where their blue tarps were being ripped off by the next hurricane. And so we have to be aware, that some of these communities are still recovering, still smarting from past seasons. And so we can't just not have that empathy and sort of act like this is all novel to everybody, but really it's compounding.
Absolutely. And people come, people who live in hurricane prone areas. I grew up in the panhandle of Florida, and my family's from Miami. They know hurricanes. They know how to handle them. They've been through it. They've lived through them. But in a way, sometimes that knowledge can work against us when, like you say, every storm is unique. Every storm is different, different, and it's so hard to forecast the intensity of hurricanes. Can you talk a little bit about why? I know you said we're getting a lot more accurate in forecasting the track of a hurricane, but
Right.
why is it so hard to forecast the intensity?
So I'll first say that we're getting better. The hurricane hunters that fly into hurricanes, and they're taking measurements of the inner circulation or the eye wall. And it really comes down to that eye wall is a very dynamic region of the hurricane. What I mean by dynamic is that it doesn't just slowly change over time. You can get what are called eye wall replacements, which are cycles where the hurricane may sort of temporarily weaken, but then strengthen right back up as one eye wall dissipates and the other one forms. And so, when a storm is heading toward the coast, right, there's a timing issue with that. And sometimes it's just, it made landfall when it was weakening, and we were forecasting it to, increase in intensity as it makes landfall. So part of it's that. Another part of it is, hurricanes are extremely sensitive to things like dry air, entrenchment, dry air from a certain level of the atmosphere can really wreak havoc in a good way of hurricanes. And oftentimes, our models can struggle with just how much dry air gets into that system. Obviously, hurricanes love that warm, moist air. That's the fuel, and that sort of drier air cuts that circulation off. And so, that's why we, whether it's a good news development where it makes landfall at a weaker intensity, or, like in the case of Hurricane Michael, just exploded from a tropical storm to a Category 5 during a holiday weekend, where getting the word out and really getting people focused, hey, there's a hurricane coming, was a challenge.
Yeah, thank you. Yeah, it's hard, like you say. These always seem to happen at the most inconvenient times, whether it's a holiday weekend or emergencies happen on a Friday, late Friday afternoon, as I'm sure everyone who's been involved in any kind of emergency response on the call knows. We're running out of time, but I did just want to also, invite those of you in the chat to this part of the conversation too. But how can others help National Weather Service as a hurricane is heading for landfall? How can community leaders, be part of the solution and what we need to do?
Yeah, so great question, kind of to end our time together. The biggest thing that everyone can do is get the word out. The National Weather Service has true and tried communication channels. We're very active on social media. We're well connected to the TV meteorologists across the country, but there are vulnerable populations out there: the elderly, the immobile, the isolated. The people who aren't on social media, and they aren't as connected as others, but they're just as valued, and we need to reach them. I think the bottom line to your question of how people can help is engage others, engage your family members, engage your neighbors, and engage those who are most vulnerable to the impacts of hurricanes.
I agree. Thank you.
Okay, and I just wanted to say thank you everyone for joining us today. It's been great to have you, and we really appreciate your help as the larger participants in hurricane response. We appreciate your help in help getting these important messages out to the general public, which may save lives, may help protect property, may help prevent injuries and illnesses. It's very important, so thank you. And if you have any follow-ups, please email us at ehnexus@cdc.gov. And thank you very much. Goodbye.